Good afternoon, everyone. Thank you for joining our Certified Health IT Surveillance Capacity and Infrastructure Improvement training this morning. Today's webinar is being recorded and will be made publicly available through the healthit.gov website. You'll see the link at the top bullet of your presentation now. During today's event, please be sure to mute your phone line to avoid background noise throughout today's presentation. If you should have questions during today's event, please enter them through the chat box provided in the top right-hand corner of your screen. All questions from today's event will be answered in the form of an FAQ and will be made publicly available through the Certified IT Surveillance Capacity and Infrastructure Improvement website on healthit.gov. To ask a question during today's event, please use the Q&A function located in the top right-hand corner of your screen. Once all questions have been collected, they will be answered in the form of an FAQ through the healthit.gov page. For questions that are not submitted through today's chat box, please submit them to the onc.certification@hhs.gov email address. These questions will be compiled with the questions collected from today's event and will be posted on the healthit.gov website as well. With that, we'd like to welcome today's speakers, Sarah Clark, the Program Analyst with the Office of Standards and Technology through ONC, John Norman, a Program Analyst with the Office of Standards and Technology with ONC, Lynette Peryoung, a Program Coordinator through the Office of Grant Management with ONC, and myself, your WebEx moderator, Ashley Hughes. And with that, I'm going to pass it to you, Sarah.
Thank you. All right.
When she gives you the controls, you just
Sorry about that. Thank you, everyone, for joining. We're going to go over some background on this funding opportunity. It was posted July 13th. ONC released an FOA for the Certified Health IT Surveillance Capacity and Infrastructure Improvement Program. It's worth $1.25 million, and we expect to make 1 to 3 awards out of this FOA. So that would be 1 to 3 cooperative agreements associated with that amount. The period of performance for this FOA is 24 months in total. Letters of intent are due by July 27th, 2017, and FOA applications are due by August 14th, 2017. Some project objectives for this FOA is to improve the surveillance capacity and infrastructure that exists for Health IT certified under the program, with a particular focus on capabilities that are directly related to interoperability, that are most desired and of greatest value to the Health IT consumers and individual users. For example, providers, hospitals, individual users, etc. Timeline for this FOA, key dates are the FOA was publicly released on July 13th of 2017, and it will finish and close out on August 14th, 2017. Letters of intent are due on the 27th of July, 2017. The application period of 30 days begun on July 13th and will end on August 14th. The anticipated award date is sometime between September 18th and September 20th of 2017. And the period of performance will begin September 18th, 2017, and will end 24 months later, September 18th, 2019. The deliverables associated with this program are broken down into 2 phases. Phase 1 being the planning phase to be completed within the first 12 months of the award. There's a draft and final strategic plan that will be due during that time, a draft and final operational plan, and phase 1 implementation of technical and infrastructure business practices and personnel. Phase 2 is the implementation phase of the project, and there should be successful implementation of strategic and operational plans in 2 of the 4 domains, successful implementation of strategic and operational plans in the remaining 2 domains, and a draft and final surveillance report. This is a task timetable. The details of these tasks are outlined in the FOA, but we'll just go over them from a high level. Task 1, there'll be a kickoff meeting with ONC within 5 business days of the award. There'll be a draft strategic plan due within 2 months of the award. There'll be a final strategic plan due within 4 months of the award. There'll be a draft operational plan due within 7 months of the award. A final operational plan will be due within 10 months of the award. And phase 1, implementation of technical infrastructure, business practices and personnel associated with 2 of the 4 acceptance of the final strategic plan and operational plans and implementation key technical business and personnel actions to ensure successful implementation of plans in phase 2, which will be the upcoming plan, will be due within 12 months of the award. So for phase 2, there'll be a kickoff meeting with ONC within 5 business days of receiving approval from ONC to proceed to phase 2. Successful implementation of strategic and operational plans associated with 2 of the 4 milestones from the final strategic and operational plans will be due within 16 months of the award. Successful implementation of strategic and operational plans in the 2 remaining domains will be due within 19 months of the award. A draft final surveillance report will be due within 22 months of the award, and the final surveillance report will be due within 24 months of the award. We're going to go ahead and pass it over to John to cover the next topic.
Okay, I have it. Well, thank you, Sarah. So this particular section will cover 3 things: funding, eligibility, and the information about the application. All right. So just a quick recap summary. This is pretty much for your knowledge that the due date is August 14th. The award date is anticipated to be September 18th, and it's a 2-year, 24-month award. And so the next actually due date that we're looking at is to identify your intent to apply through the notice of intent, and which is due on July 27th. Some key identifiers that needs to be on this notice of intent is your name of the organization, the city and state, the full, of course, the title, and all this information can be submitted to onc.certification@hhs.gov. The 2 key elements for to be eligible for an applicant. First of all, you have to be a specialized group that's for-profit that has an ISAO IEC 17065 accreditation that is in good standing with the American National Standard Institute. The second critical piece is before you have some experience in performing certification in the field surveillance for health IT. The process, once you start to apply for this FOA, the process is pretty simple. We want you to go to grants.gov, outline the FOA. If there are any issues with applying for this grant, there is a help desk under grants.gov. You can email them, or you can use the 1-800 number to call any questions when applying for the FOA. Also, you need to have a DUNS number, the Dun and Bradstreet Universal Numbering System. And then third, you want to make sure you register under SAMS, the System for Award Management. If you already have an account with SAMS, if you have not renewed in the past 12 months, make sure you renew. The critical piece is it takes a minimum of 5 days to register, so make sure you put that into your project plan when applying for the position prior to August 14th. And then lastly, to ensure that application meet all required limits and components of the application for it. And the required limits and components of applications are as follows. There are several key components to applying. The project abstract, which is less than 500 words. The project narrative, which is was at the most 20 pages. And there are several forms that you make sure you have to complete: the SF-424, the SF-424A, the SF-424B, the SF-LL, lobbying activities, and as well as your budget narrative, letters of commitment, proof of nonprofit status, indirect costs, and of course, proof that you have an ISO IEC 17065 accreditation, as mentioned earlier. So there are two primary components from this that will stand you out between other applicants, which is one is the project abstract and the project narrative. The project abstract is pretty much a high-level summary report that is pretty clear-cut description of your project scope, goals, objectives, and overall approach, and your potential outcomes. We would like this format to be presented in a particular way. As I stated before, no more than 500 words, single space, project title, your organization's name, your address, contact information, email address, and there's a website applicable as well. We would like to have that also. The second critical piece to the components is the project narrative. It's a little more detailed. It articulates your program description, your purpose, the structure, as well as we want to make sure you align this with the actual FOA. So make sure you thoroughly read what the requirements for this particular FOA. Then the second piece is also critical is the format, which will make sure this help us read through it easily. So the format has to be double-spaced, no more than 20 pages. Format standard, 8.5 by 11. You have two options for font, 1-inch margins, font size 11 or greater. Again, if it's greater, you have less pages, but 11 or greater. And of course, this has to be this is a fixed format, and so if it's not in this format, it will not be read or considered as well. Also, a part of the narrative, we'll make sure you have these key critical elements of part of your narrative. First of all, the problem statement, which identifies your gaps and challenges. The project scope, which is the strategy and your approach. The organization, and as well to identify your experience, the level of experience in the field of surveillance and health IT, is your current business assessment, and your knowledge base in terms of the gap analysis in your community. Any more details in this is also laid out in the FOA, so please refer to that as you develop your application. Next up, I'll turn back over to Asad.
Thanks, John. So we'll go over the application responsiveness and objective review process here. So for the application review process, you submit all application materials electronically through grants.gov. Grants.gov will issue an email receipt upon successful submission. You want to make sure you receive that. ONC will then receive, ONC issues receipt upon successfully obtaining files from grants.gov. Applications are reviewed for responsiveness and categorized as pass or fail. All applications that pass the review for responsiveness are forwarded for objective review. And once objective review is complete, ONC may make a reward. ONC is not obligated to make an award if none of the applications meet the intent of the program requirements or if funding levels are available or availability changes. The application responsiveness criteria we'll cover next. Applications not meeting the following completeness criteria will be administratively eliminated and not sent for merit review. The applicant must meet the eligibility criteria. The application should be received by the deadline, August 14, 2017, by 12 p.m. noon Eastern Time through branch.gov. The application must contain all required components, for example, the project abstract, project narrative, SF424, etc. The application must meet all formatting and length requirements, and appendices and attachments will not count towards the project narrative. We'll go over some of the merit review criteria. Responsive applicants are forwarded for merit review. Merit review will be conducted by a review panel of at least 3 experts in their field from academic institutions, nonprofits, and local and federal government agencies. Applications can receive a maximum of 100 points using the following scale. Understanding the requirements is worth 25 points. Innovative business and technical approach for enhanced surveillance is worth 30 points. Organizational experience and knowledge of health IT certification and surveillance is worth 40 points. And reasonableness of the budget narrative is worth 5 points. This first component of the merit review criteria, understanding the requirements, which is worth 25 points, covers the extent to which the applicant has addressed the vision, goals, objectives, business, and technical strategies to enhance their ability to perform in the field surveillance of certified health IT. It assesses the extent to which the applicant has identified gaps and challenges in the current marketplace surveillance activities of certified health IT and how they propose to address these gaps and challenges in order to assess continued conformance of ONC certified health IT in the implementation setting and thus interoperability nationwide. The extent to which the applicant is available to clearly communicate its strategy to improve current surveillance capacity and infrastructure relative to certified health IT will be assessed, and it should include identify baseline measurements and evaluation metrics for surveillance activities currently occurring, if applicable, to track progress over the duration of the cooperative agreement period. Lastly, the extent to which the applicant communicates how they plan to support the long-term capabilities for surveillance and real-world testing activities that provides for a more comprehensive approach for planning how to assess continued conformance of certified health IT. The next merit review criteria, innovative business and technical approach for enhanced surveillance, which is worth 30 points, will assess the extent to which the applicant proposes to account for and recoup the full cost of enhanced surveillance and real-world testing. The extent to which the applicant demonstrates the assessment of their current business model and proposed expansion and enhancements to the surveillance of certified health IT, and the approach with which the applicant intends to develop the capability to effectively generate and manage funding necessary to implement their strategic and operational plans during the full period of performance of the cooperative agreement. This capability should include establishing financial policies and implementing procedures to generate revenue, monitor spending and overall fiscal responsibility so that investments made during the period of performance will be able to continue to be maintained after this cooperative agreement. The merit review criteria that covers organizational experience and knowledge of health IT certification and surveillance is worth 40 points, and assesses the extent to which the applicant is able to clearly demonstrate they have the organizational experience to achieve the programmatic goals and objectives of this FOA. The following credentials and/or documentation must be included in order for an applicant to be successfully considered for this award. And those are proof of ISO 17065 accreditation and good standing through ANSI, the American National Standards Institute, 3 years minimum experience with certified health IT surveillance, an active mechanism to publicly list health IT certificates and relevant surveillance results, and a certified health IT surveillance plan that meets the most recent ONC health IT program guidance. That program guidance there's a link that will take you directly to that program guidance at the bottom of this slide. This particular criterion continued will assess the extent to which organizational roles and responsibilities are clearly defined and aligned with the goals and outcomes of this cooperative agreement, the extent to which the applicant brings or plans to involve personnel with appropriate experience and backgrounds to support the successful planning and implementation of its proposed strategy for enhanced surveillance in order to meet the goals and objectives of this FOA, the extent to which the applicant can clearly address how to quantitatively and qualitatively improve surveillance activities of certified health IT with a focus on certified capabilities that directly support interoperability, as those capabilities have the greatest potential to impact the health IT consumers and individuals, for example, providers, hospitals, and individual users. And lastly, the extent to which the applicant can address continuous improvement in ensuring the effective, accurate, reliable, and financially sustainable surveillance and real-world testing of certified health IT within the scope of the health IT certification. The last merit review criterion is the reasonableness and budget narrative, which is worth 5 points, and this assesses the extent to which the budget is justified with respect to adequacy and reasonableness of resources requested.
Thank you, Sarah. This is the conclusion of the details of our information session. At this point, we will be looking at any questions, addressing any questions that you may have, and all the questions that you may have will be submitted either through the chat box, which you have access to submit at this time. We will collect those questions in the chat box. They will be responded to via the FAQ that will be posted on the healthit.gov site. If you have questions beyond today, things that may come up after this presentation and after the WebEx close, please email those questions to onc.certification@hhs.gov. Next slide. We want to thank you for attending this session. We will keep this session open for 5 minutes. And we will do a countdown as such to keep you posted as to the amount of time you have remaining to submit your questions through the chat box. Please remember that you can see the FOA on grants.gov, or to apply, go to https://www.grants.gov and follow the remaining alphabet on the address as you see on the screen. For assistance with submitting applications in grants.gov, please contact the grants.gov help desk at support@grants.gov or call 1-800-518-4726. Our 5 minutes will start at this time. You now have 3 minutes remaining. We have 1 minute remaining. This concludes our session formally at this time for the chat box submission of questions. Please note that you can continue to submit your questions through the website, as indicated earlier, and this line, WebEx, will remain active for 5 more minutes in case you wish to download the presentation that is available to you when you exit out of the system. Thank you so much for attending, and have a great afternoon.